Public and community health is means to a health and well-being of a population. Public and community health are able to detect, treat, and prevent disease through structure and funding that is supported by our nation's government. However, the policies developed and implemented by public health agencies must follow a code of ethics developed off the idea of strong and clear communication. Charles Edward Amory Wilson, founder of the Yale Public Health Department, described public health as the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and for the development of social machinery to ensure everyone a standard of living adequate for the maintenance of health. So organizing these benefits as to enable every citizen to realize his or her birthright of health and longevity. Public health in today's world still works off the idea of Winslow established. Public health agencies are focused on ensuring everyone's well-being by addressing the health needs of those most in need. The idea of achieving a healthy and well population is nearly impossible without public health to ensure early intervention, prevention of diseases. The three functions that allow public health to be effective are assessment, policy development, and assurance. Assessment of the public's health is done by analyzing health statistics, health disparities, as well as epidemiological studies. Policies are implemented to address any and all deficiencies that came to light during the assessment. These policies are established and based off scientific evidence to achieve a higher state of wellness. Assurance that the policies implemented are the necessary vehicles to achieve the desired state of health and wellness. Community health operates off the same key principles of public health. The major differences is that community health is the focus on specific populations and the health disparities found in that population. For example, addressing the high rates of diabetes in the Hispanic American populations would be considered community health. Why worry about healthy population? The effect of chronic illness has on economic status of the individual as well as the community is the sole reason to strive for a healthy society. On the individual level, chronic illness often leads to early death and can inhibit your ability to work, which results in increased income for you and your family. Here in the US, income levels are not in sync with the skyrocketing cost of living. This gap is resulting in higher rates of poverty. That poverty leads to individuals' inability to pay for insurance as well as food insecurity. The lack of insurance limits a person's access to adequate care, while food insecurity increases individuals' risk to preventable diseases like obesity and diabetes. Public health here in the U.S. is organized by federal, state, and local agencies. Federal public health agencies are primarily focused on the ability of every level to provide adequate and necessary health services. Federal agencies are able to do so by regulating policies, funding research, and training and education. State public health agencies are designed to focus on health disparities of the specific state. This is done through detection, treatment, and prevention of diseases and illnesses. Local public health agencies are designed to observe health disparities, promote health policies and programs, and direct individuals to a specific community to their appropriate health services. The Code of Ethics, established by the Public Health Leadership Society, states that public health should address the fundamental causes of disease and the requirements for the health and disease prevention. Public health agencies should achieve community health in a way that respects the rights of the people in the community. The policies and programs are to be developed and assessed through evidence-based procedures while still allowing input from the community. Public health should act as an advocate for the disadvantaged populations and strive to ensure the basic needs of health for that community are met. Data relevant to the health promotion shall be the main focus of public health agencies. Policies developed for public health will be available to the public in full disclosure. And consent from the community is needed before any policy is implemented. Appropriate action will be taken in a timely manner. Policies and programs will be designed to meet the religious, economical, social, and other cultural beliefs that specific community has. The developed policies and programs are to be implemented to ensure improvement of the community's physical and social environment. All information gathered to analyze the health of a community will be protected and deemed confidential. Public health agencies must ensure professional competency throughout the entire agency. Here in the U.S., the Affordable Care Act is able to fund public health through the Prevention and Public Health Fund. Currently, the Prevention and Public Health Fund has allotted $927 million for the preventive health research, surveillance and tracking, public health infrastructure, immunizations and screenings, tobacco prevention, and public health workforce and training. The majority of the funds were given to the CDC to continue work on heart disease, tobacco control, diabetes prevention, prevention of healthcare associated infections, as well as other critical public health issues. It has been estimated that for every 10% increase in funding for community-based public health programs, death can be reduced by 1 to 10%, and $2.9 billion invested in community-based disease prevention programs have the potential to save $16.5 billion annually. Strong, well-established communication is pivotal in the success of public health systems and developed programs. Public health system here in the U.S. is a multidisciplinary web of professionals and organizations. For the best possible result, clear and accurate data must be gathered and analyzed. To do so, professionals like epidemiologists, doctors, and EPA agents work together to ensure accurate assessment of the population and their health needs. The need for strong communication is seen during policy and program development and implementation. One of the best ways illness can be prevented is through education. For example, reducing rates of diabetes calls for a change in lifestyle. This change in lifestyle is accomplished through clear and smartly presented information. At the same time, the policies implemented should respect the target audience and meet their cultural needs. If the communication pathway is not established, then the desired task cannot be accomplished.